Welcome to the Robinson Show. Today we'll be talking about pregnancy and the health risks that can be developed during pregnancy. Now, pregnancy can bring us the cutest bundle of joy, but we should be aware of the health risks that can be developed during pregnancy and how they affect us and our child. Now, today we'll be talking to Josie Wilson, who is pregnant with her first child and has developed high blood pressure. We'll also be talking to Dr. Jay Hodowanski, who has specialized in high-risk pregnancies. Now, welcome, Josie Wilson. Hello. Josie Wilson, thank you for being on our show today.
Thanks for having me.
No problem. Now, how far along are you in your pregnancy?
Just coming up on 6 months now, in a couple days.
Do you know the sex of your baby?
No, I decided to keep it a secret.
Very nice. Now, when were you diagnosed with your high blood pressure?
Probably around 3 months into my pregnancy is when I actually found out.
Now, do you understand the risks that high blood pressure brings to yourself and your unborn child?
Not exactly. It's really confusing to me, actually. My doctor tries to explain it to me, but they use, really big medical terms, and it just, I just always thought that it would affect me, so I don't really think it'll affect my baby. I hope not.
Good news is that we have Dr. Jay Hodowanski, who is specialized in high-risk pregnancy here today, and she'll be talking to you about your high blood pressure.
Oh, that's good.
Yes.
Because then maybe I can get low blood pressure.
Maybe.
Or normal blood pressure.
Okay. Now welcoming Dr. Jay Hodowanski. Hello, Doctor.
Hello.
Now, Dr. Jay Hodowanski, we brought you here today because Josie Wilson is pregnant and she has developed high blood pressure during her pregnancy. Now, what exactly do you do?
I'm a doctor who specializes in high-risk pregnancies.
So, having high blood pressure during your pregnancy is considered to be a high-risk pregnancy.
Yes.
Now, what is high blood pressure during your pregnancy?
Well, the medical term is called gestational hypertension, and basically that is high blood pressure during pregnancy. It's caused by an unknown set of factors, and you don't have to have existing high blood pressure to have it during your pregnancy.
Now, what exactly are the signs and symptoms? What should one be looking for?
If a pregnant woman is experiencing a number of symptoms, then she should consult her doctor. Some of those symptoms include rapid weight gain, 4 to 5 pounds in a single week, a raise in your blood pressure, protein in your urine, severe headaches, blurry vision, or severe pain in the stomach and the abdomen region. Now, yes, some of these symptoms cannot be detected by the woman herself, which is why we encourage a pregnant woman to go in and do regular ultrasounds and visits.
So if high blood pressure runs in the family or someone in the family has developed high blood pressure during their pregnancy, it's definitely something that they should keep on the lookout.
Yes, they should notify their family doctor immediately, and they can keep an eye on it.
Now, what is the risk of high blood pressure during the pregnancy? Does it only affect the woman? Does it affect the child?
It affects both. With high blood pressure, there is an increased risk in the resistance of blood vessels. This may hinder blood flow to many different organs, including liver, kidneys, brain, the placenta. And problems with that, the placenta can break. There can be intrauterine growth restriction, which is poor fetal development, and stillbirths can occur.
So if you're not getting regular blood flow to the placenta, that can damage the growth of your unborn child.
Yes, if they are untreated, it can cause dangerous seizures and even death in both the mother and the fetus.
Now, if you have high blood pressure before you're pregnant, is it considered to be the medical term that you are using?
No, gestational hypertension is specifically high blood pressure while you're pregnant.
Now, does that go away once you are not pregnant anymore?
Yes, it can. And during pregnancy, it's important that the baby's being monitored, and certain medicines can be helpful, but yes, it does go away.
Now, speaking of medicine, what is the treatment for your high blood pressure during your pregnancy?
Like certain medicines that help reduce the blood pressure, and certain lifestyle changes can occur: exercise, eating healthy, and always monitoring the baby to make sure growth is proper and everything like that.
Okay, well, I definitely have learned a lot from Dr. Hodowensky, and I'm sure Josie Wilson has as well. Now, coming up next week is A Dog Who Can Talk.